Before the break, we have Dr. Choi Yu-Fai, who serves as a consultant in emergency medicine at PYNEH, and he's also the Center Medical Directors of Post-Dispatch Advice at the Fire Service Department, and the Chief Examiner of the Intermediate Examination on Emergency Medicine at Hong Kong College of Emergency Medicine. So Dr. Choi is currently one of the few professionally trained educators, who had a master degree in clinical educations. And so I personally adore his passion in education, and it actually influenced me a lot as well. So welcome so much, Dr. Choi.
Thank you, Alex, for your kind introduction, and thanks for keeping the time. I will keep my talk short so that we can have a punctual break time. Okay, actually, I was assigned a difficult topic, which is such a big topic. So I have to make a choice on how to present the topic in only 20 minutes. So let's start. In our college, Hong Kong College of Emergency Medicine, we have two structural training courses for our trainer. One is on basic medical education, that is for all the trainers, and the other is for our college examiners. All these two courses, they are designed to have e-learning part, which cover most of the knowledge, and the face-to-face time is nearly 100% interactive. For these two courses, there are something in common, that is, we both talk about feedback. And coincidentally, even we put a lot of emphasis on feedback in our course evaluation, the participants still want to learn more about feedback. Maybe feedback is a charming topic, and maybe they feel inadequacy on providing feedback to their trainees. So today I'm going to pinpoint my talk on feedback. So in the past, what can we talk about on the topic of feedback? Conventionally, we talk about feedback model, and we also give some tips of the feedback. This is common in most of the training materials. But in the recent literature, we can encounter a term called feedback literacy. Actually, literacy is a fashionable term. Yesterday, I heard Dr. Loida talking about data literacy. Actually, for feedback, there is another term called feedback literacy. So, what is feedback literacy? Actually, feedback literacy was described by a scholar in Hong Kong, University of Hong Kong, Carlos and Bound. Carlos is working in the university in the education department of University of Hong Kong. In his feedback literacy, there is a shift of active role from teachers to students. So actually, students played an active role in feedback literacy. So the trainer also take a role. I will explain later. So in feedback literacy, there are four important aspects. First, the student need to appreciate the intention of feedback, and they need to make judgment on the contents. More importantly, they need to manage their emotion. Actually, emotion, I think, it is underemphasized in the past, and actually emotion really play an active role in receiving the feedback. And finally, most importantly, take action to improve. In their work of Carlos and Bond in feedback literacy, they give two practical tips. These are peer feedback and exemplars. And lastly, but not least, they also highlight the role of trainers or teachers. Teachers, they need to do something on curricular design to enhance feedback literacy development. Apart from that, each trainer should also take a role of coaching and role modeling. Again, my question is, apart from students or trainees, they need to manage their emotion. How about teachers? Do teachers also have emotion? The answer is probably yes. And now, so back to my topic, how should we train our trainers? I want to limit my presentation to only a very small area of the curriculum, that is how to train our trainers on the emotional aspect of feedback literacy. Just a few words on the background of my presentation. As I've mentioned, I teach 2 courses. In this presentation, I'm going to talk about the encounter difficulties in clinical feedback from a group of participants from anesthesia department. And in this course, not only the trainers, there are also new graduate trainees join the course. So their opinions were also taken into account. Now you may wonder that we are now talking about emergency medicine. Why? In this study, the participants are from anesthesia department. Actually, the learning environment, especially the clinical learning environment, is quite different in anesthesia. In anesthesia, in the training context, it's a trainer with a trainee in the operation theater. After putting the patient down, the trainer has plenty chances to give feedback to that trainee after induction. And the same is true after recovery. Unlike the emergency department, where everyone is busy, the seniors are busy, the juniors are busy seeing their patient doing resuscitation, we don't have a so-called protective clinical time for feedback. And when do we encounter difficulties? That's when a teacher really takes serious on the feedback. They will encounter difficulty. In another word, if you don't give feedback, you will not encounter difficulties. I hope this is not the situation in emergency medicine. Okay, so here are the collective response. There are many, but I just highlight some of the common ones. And if you read their statement or their quotes, you may be familiar with the feeling right now. These are their quotes, so they didn't improve feedback. That means the training didn't improve. They try to escape. Many trainees are having a fragile heart. I don't want to hurt them. But trainees always deny my critics, and they always have some excuse. And lastly, I should not be the person to do the feedback. It should be done by, say, training supervisor or somebody else. Now, these are their difficulties. Okay. Now, we are talking about emotion. Before we can understand emotion, I want to give you some of the basic, I would say, theories on the emotions. In the previous presentation by Dr. John, we also received a lot of theories. Actually, education is like that. We deal with a lot of theories. But for emotion, I want to make those theories simple. So I just use some common sense theories. One of the theory of emotion is that we have primary emotion. Primary emotion are very simple. Depends on which sources you have. Some say that we have 6 primary emotions, some say we have 5, but primary emotion are just happy and unhappy, or scared, or powerful, joyful, like that. And primary emotion can generate secondary emotion. For example, if you feel sad, you may feel depressed, and you may feel apathetic. And if you feel mad, you will be angry and then frustrated with your trainees. That's simple, right? This is common sense. Another common sense theory is the cognitive behavior therapy model. Very easy to understand. Emotion will affect behavior. If you got emotion, you behave differently. Again, vice versa is also the truth. If you observe a behavior, it probably reflects an underlying emotion. Right, these 2 theories are very easy to understand, right? So back to our response. Look at these responses, look at this statement. What is the likely primary emotion? Easy to understand, sad. Okay, what happened to that teachers? They are sad about their feedback process to the trainees. Okay, so upon their primary emotion, these trainers may feel rejected, discouraged because the trainee didn't improve, the trainee escaped from their feedback. And they maybe have a sense of helplessness and even anxious. Why our trainees didn't improve? Is it our fault? They began to have self-blaming and guilty and become depressed. And finally, apathetic. Oh no, I don't want to give feedback anymore. They don't listen to me. They are angry, they are frustrated. So it is all about emotion, right? Actually, you might wonder why we talk about so much on emotion. Actually, education is a branch of psychology, and under psychology, education psychology is a major subspecialty. So if you want to be an educator, you need to know a lot of theories of psychology. But when we want to train our trainers, we don't want to bother them with so much difficult theory. So what we are talking about is just the common sense theory, easy to understand theories. Okay, it's all about emotion. Okay, take a look again on this response. They are quite, some of them are quite similar, while some of them are different. The first line, they did not improve with feedback. This is a observation with judgment, right? The others are purely description of behavior. So the first sentence is a bit complicated. I will talk about it in a moment, while the others are quite similar. Okay, these are the others. They are similar in one way, is that I don't like to give feedback because when I give feedback, I generate some negative emotions. Okay, now we took a brief look on the first sentence. Why my students not show improvement? Actually, this statement is quite complicated because we need to look at this statement from two perspectives. One is from the student and the teacher. For the student may actually improve, but the progress or the magnitude of progress was unseen by the teacher. Actually, this is the feedback by trainees in that course. I have improved, but the teacher did not appreciate it. Well, from the teacher's view, their observation is that, oh, I didn't see it improved. Why was that? Actually, there are some real reason of not improvement. That is when there is no improvement. The student did not understand. In the literature, it says students are more likely to change their judgment if they are told to do so. So for teachers, they need to explore students' judgment. Whether I give my feedback, did the student have the proper judgment? And the second thing is the content of feedback or quality of the feedback. Is the feedback specific enough and tell the student how to improve? So this is the one aspect on real no improvement. The other thing is that there is improvement but unseen by the teachers. Usually for the trainers, their point of view is that if I taught you, you must know and you should improve. If you don't, you didn't put your effort. And this blaming and self-blaming emotion may generate frustration. But we need to make judgment and manage our emotion, right? So what did the literature care about on this aspect? Actually, when we are making judgment, they said students tend to mix up effort and quality. Effort is the will to change, while the quality is the result. But the truth is not only mix them up, the teachers or the trainers also mix the two up. They did not see the students' effort, but they only see the quality. And they did not allow time or patience to let their student to improve. So why my student did not improve? The underlying causes may be very complicated. Okay. Now we move to the more simple part of the emotion aspect. Say I put this example as my trainees are having a fragile heart. I don't want to hurt them. Okay. He's having a fragile heart. student or the teachers? Now, can you read the emotion from the sentence? Actually, maybe there's anxiety. I don't want to hurt them because they are hurting me. And maybe they are self-blaming. So for this case, we can see that negative emotion generated from feedback experience exists among teachers. Next, when we know that, how should we train our trainers, or how should we help our teachers? Here I offer 2 tips. These are 2 tips, all common sense tips. The first one, you may well know EQ by Daniel Goleman. All of you have heard about EQ, but some of you may have a misconception on the true meaning of EQ. Some may think, oh, EQ means that we should not have emotion, we should suppress our emotion. Actually, this is not the case. Actually, emotion is normal, but in the EQ, the author emphasized that we should be aware of our emotion and manage our emotion, not only for ourselves, but also others. If we can recognize or manage the emotion of others, say for example, empathy, then we can deal with the emotion of our students. But this is much more complicated. But the first step is we need to have self-awareness. If we have self-awareness, there are probably 2 potential benefits. The first one is that we probably can prevent our primary emotion go into secondary emotion. Probably. The second thing is that we probably can prevent our primary or secondary emotion change into undesirable behavior. That is escape from feedback. Okay, so next tip is to build a strong insight. Here, I would like to quote the work of another psychologist. Actually, it's a very famous psychotherapist. She was Virginia Satir. Virginia Satir has a lot of theory, but here I want to make it simple by quoting one of her poems, When I Am Strong Enough. Look what he said. When I'm strong enough inside, you blame me, I feel your pain. You flatter me, I see you need approval. You're crazy, I understand your vulnerability and fear. You interrupt. I know how much you want to be seen. Look, here, the emphasis is every behavior of our trainees. There is anxiety and vulnerability behind. If we as a trainer have a strong insight, we will not be affected by the negative behavior of our trainee, but instead we understand them more and know how to help them. Here, the most important message is emotion is okay. There is okay to have emotion. Look at the bottom lines: grievance, depression, guilt, sadness, anger, pain. Whenever they flow freely, I feel warm in sorrow, feel strength in anger, and see hope in pain. What a great poem, but actually the poem has highlighted some of the important principles in emotion. That emotion is all right, but we should be aware of emotion and be aware of the behavior generated from those emotions. Okay, let's make a summary. What our trainers should know about their emotions in feedback. First, we should understand emotion will trigger emotion. Students with low feedback literacy or bad emotion may actually affect our trainers' perception. So the trainers should be aware of their own emotion and also the emotion of the trainees. If possible, understand the emotion behind their behaviors. If trainers feel sad or even anxious, it's okay. It is okay to have emotions. But trainers should be able to manage emotion in order to play the role as a coach and role modeling. So this is what we teach our trainers on the emotional aspect. So is it all about emotion? Maybe no in the feedback, but I think in the past, why people encounter difficulty in the emotion and why there are problems or difficulties. I think emotion may be the gist for successful feedback, or probably maybe the culprit of some unsuccessful feedback. So for our trainers, if possible, we can build a strong insight like a lion and help our students. Thank you very much. And you are welcome to contact me through the email here. And I would like to answer your questions whenever possible. Thank you.
Thank you so much, Dr. Choi. I think it is really interesting and wonderful talk because I have seldom thought about it actually, and I have heard and learned about a lot on feedback model, how to say your feedback, for example, like a sandwich approach, something like that. And so seldom do I think about the emotion of the trainer actually. So I think I have considered a lot the emotion of the trainee, the student. But I think yes, you are quite right that the emotion of the educators, the trainers, is very important as well. So so far I see there's no questions, so maybe I will take the privilege to ask. And so would you give us some practical tips on how to control or how to have possible positive emotions as an educator?
Well, actually, the temptation to manage emotion may be real among teachers. Some of teachers, they want to suppress their emotion. They even want to suppress the emotion of the students.
Yeah.
But what psychologists say is that emotion is normal. It is normal if you have very bad emotion.
Yes.
If it's you, right, we cannot change. Emotion, there's nothing wrong about feeling an emotion. This is what we have learned from debriefing model. I think Dr. John will also agree that. But the important thing is that when we encounter emotion, no matter it is from student or it is from ourselves, we understand it and we recognize emotion is there. And we prevent emotion to go into negative behavior. It is the behavior will hurt others or make feedback ineffective, but not emotion. So we for our clinical teachers, because our clinical teachers, they are not psychotherapists. So what I advise is that if they can be aware of their emotion or the emotion of the students is already perfect, and don't try to manage them because they are there, but try to manage behavior and to try to nurture positive behaviors. That is, if you encounter a negative response from your team, you don't stop giving feedback. Continue with that because that will help you.
I see. So what should I do if I really feel angry?
Just let your anger
what did you do?
flow freely. You can be angry. It's all right to be angry.
Okay. Yeah.
I always become angry with my trainees.
Okay, fine. Okay, so thank you so much for the really insightful talk.